for those of you who don't know us, Trellis is the charity that supports therapeutic gardening in Scotland, with over 480 gardening projects in the network. We provide information, training, and good practice sharing, and we aim to promote the highest quality of gardening services and enable everyone to get the best out of them. You can find links to all our resources online on the Trellis homepage. So today's session is approximately 60 minutes, and it comprises a presentation of 40 minutes, followed by a Q&A session. So please use the chat feature to ask your questions throughout the presentation. And then we'll ask one of our team, which today is going to be Joan, to voice the questions to our presenter. Towards the end of the session, we're going to ask you for some feedback, and we'll put a link to our short survey in the chat box. During the presentation, you can manually move the Zoom thumbnails out of the way of the presentation. You can click and drag and move them to the side so that you can see the slides more clearly, and you can minimize and maximize them. So it's a great pleasure and a privilege to welcome our speaker today, who is Dr. Derrick Stowell. And he's here to talk about horticulture and therapy in the United States. He's talking to us today from Tennessee, and there he is the Education and Horticultural Therapy Program Administrator for the University of Tennessee Gardens. And he's responsible for directing education and horticultural therapy programs there at the Knoxville location. He has a bachelor's degree in outdoor recreation and environmental studies from Maryville College, and a master's degree in therapeutic recreation, and a PhD in plant, soil, and environmental science from the University of Tennessee. And I'm just going to highlight Derrick here so we can all see him. Lovely. So Derrick has he's a certified therapeutic recreation specialist, and in 2015 he became a registered horticultural therapist through the American Horticultural Therapy Association. That's the AHTA. Derrick served on the board of directors for the AHTA from 2016 to 2018, and is currently their president-elect for 2021. He has presented, consulted, and published on horticultural therapy and the healing aspects of gardening. And in 2016, he received the Rhea McCandless Professional Service Award for his contributions to the profession. The horticultural therapy programs he has created serve a variety of populations, including veterans, individuals who have intellectual disabilities, individuals who have dementia or Alzheimer's, and those with behavioural health and at-risk youths. So without further ado, I'll now pass you over to Derrick, who will share his screen and his presentation. Thank you, Derrick.
Thank you, and thank you for inviting me to speak today. I do want to say good afternoon from here in Knoxville, Tennessee. Today I'm going to be talking about horticulture and therapy in the United States, and really we'll be spending some time reviewing a study that I conducted as part of my PhD dissertation. So one of the things that I think working with plants and horticulture is really important is to see the benefit of the human-plant interaction, and that this quote I think helps understand and solidify that. And particularly in the last year with the pandemic, we've noticed a lot in the United States, at least, a huge increase in interest in gardening, people going out planting gardens, particularly when things shut down and when there was a lot of uncertainty and supplies, food supplies and other supplies were in limited demand. And so I find that, looking at the idea of planting and gardening is a way to help instill hope in people, from simply planting a seed and knowing that eventually you're going to get some kind of flower or a produce that you could eat or you could use, and then enjoyment from that is a really important part of the therapeutic aspects of gardening and horticulture. But today I do want to talk about a little bit about therapeutic horticulture in the United States, particularly based on a study that I conducted. This study was a review of horticultural therapy and horticulture therapy education in the United States. This study was conducted in November 2019, between November 2019 and January of 2020. So it was pre-COVID pandemic. But I conducted semi-structured interviews, and I interviewed 27 horticultural therapy professionals from around the United States. So, a couple limitations to the data and the information we collected. One was this data was collected before the pandemic, and so some of the challenges and opportunities that may have developed as a result of the worldwide pandemic aren't reflected in this study. And also, majority of the studies of the profession of horticultural therapy in the United States have tended to only look at AHTA membership, so the American Horticultural Therapy Association. And in the United States, we do have regional networking groups also. And so at this time, a lot of the studies have not really looked into those regional groups and sampled that population. So our study came up after conducting interviews. We analyzed those and coded the transcripts of the interviews, and we organized those into 6 main themes that we found. The first one is the current state of the profession. Second one is American Horticultural Therapy Association operations and structure. Third one is credentialing, education and credentialing. Fourth one is job opportunities and funding, and fifth is public awareness and networking, and then 6 is the research opportunities. So I'm going to take a few minutes to kind of expand on these different themes and discuss how they interrelate, and also try to tie those into the practice of using horticulture as therapy around the world and even in Scotland. So, in the United States, the profession of horticultural therapy is still considered an emerging profession here, and even in 1998, Davis suggested that the profession needs continued validation and growth, and this can be done through 3 things: clinical practice, education, and research. And we have seen a variety of limitations in the United States based on the changes in the medical healthcare arena in the United States. And those challenges have also helped limit the professional growth here. And that's part of what our study was trying to figure out, how to determine ways to move forward. So just a quick comparison for allied health professions. And so those are professions that are medical professions that are not particularly specific to nursing or medical doctors. And there are several hundred different allied professions in the United States right now. So I did a quick look at some of the more major ones that people are familiar with. The first one is occupational therapy, and that professional association began in 1917. And currently the American Occupational Therapy Association has around 60,000 members. So it's one of the larger allied health professions in the United States. Next one developed in 1921, which is physical therapy. And there, the American Physical Therapy Association has around 100,000 members. And if you look down further, you can look at recreational therapy, which I'm also part of. Their association began in 1966, and the American Therapeutic Recreation Association has around 2,200 members. And then they also have a certified therapeutic recreation specialist, and there's around 18,000 of those. And that's the professional credential for recreational therapists. And then our profession, horticultural therapy, began around 1973. The AHTA currently has around just under 500 members, and we have a professional registration system. Roughly around 233 of those people, members, are professionally registered. And I'll go into a little more details about the professional registration, but simply in the medical community in the United States, there's different qualifications for people to practice medicine in some level. And so professional registration is one of those elements, and that requires taking a certain determined set of courses based on what we call a job task analysis. So interviewing therapists and determining what are the components, what are the educational components, and what are the minimum set of knowledge, skills, and abilities needed to be a professional in that particular profession, and also conduct an internship, and then have a board review your application. And so another level I talked about is certified therapeutic recreation specialist is an example of this, the next level, which includes also a credentialing exam that is taken after completing coursework, and has a higher level of professionalism considered in the United States, that the medical community recognizes. So, in the U.S., we have a lot of different opportunities where horticultural therapists can work. Typically, we kind of divide it up a lot of times into two main settings: as a clinical setting, a hospital rehab facility, versus a community or wellness setting, which is out in the community, working with nonprofits, working at public gardens and other organizations, or even nonprofits that work with specific client groups. So, and one of those clinical kind of settings is in the assisted living long-term care setting. So older adults. Community setting could be something like a public school, public gardens, community gardens, and then obviously hospital and healthcare facilities fit within the clinical client area. So again, we work a lot with different populations, and one of those is the older adult population. This can include individuals that have Alzheimer's or dementia. It can include individuals that are going through rehab after having surgery or having a stroke or other medical conditions. Another group that we work with in the United States is individuals who have intellectual disabilities. A behavioral health setting is also another setting we can work in. Drug and alcohol recovery programs, veterans programs, and rehabilitation facilities. And I think one thing that's important to point out is just because someone may be a veteran or someone may have an intellectual disability and they garden, doesn't necessarily mean that they are taking part in a therapeutic horticulture or horticultural therapy program. I think what sets the difference apart is the reason that they're in the program, what their goals and objectives are. If I'm just learning to garden and I may use a wheelchair, it doesn't mean I'm taking part in a therapeutic horticulture program necessarily, unless those goals are set up and developed to help me meet specific outcomes that I'm looking for in a therapeutic sense. So, one of the questions I had is kind of like, what's the daily life like as a horticultural therapist in the United States? And so one of the challenges with we currently do have is that is very varied. So people may work, horticultural therapists could work in a nonprofit setting or organization serving a specific population. Some may work in a hospital or a clinic or a treatment facility. Others may work in a public garden. And so there's a lot of variety, which is good. That's one of the reasons people like the profession, is because there's a lot of opportunities in different locations and different settings. But also challenge is the profession is helping to further clarify who we are as professionals, and to help set up standards of practice and ways to implement our programs across the board. Some of the other things that challenges we have, particularly in the last year, is obviously the pandemic and the shutdown and new regulations to try to help stop the spread of the disease. And there's also potential opportunities, though, including new delivery methods. So particularly the University of Tennessee Gardens program that we had offered before the pandemic, we did a travel program. So we would take all of our garden materials into a collapsible wagon or cart, drive to a facility, and implement our program. We were working in about 17 different facilities in the Knoxville, Tennessee area, where we go and do a 1-hour garden program twice a month. Majority of our facilities were assisted living facilities or memory care facilities. People who have dementia, Alzheimer's. And obviously, once the pandemic hit in March of last year, all that had to stop because the health facilities reduced the amount of people, actually cut out any visitors, anybody from outside coming into the facility to help stop the spread of COVID, and potentially causing a lot of disease spread in the patients, particularly because of their ages and their vulnerabilities. So that's where it required us to make some changes. We ended up creating, we called them garden kits, where we provided instructions, lesson plans, and materials for the programs, and we would deliver those to the facilities, and their staff in the facilities were able to conduct those programs. We also we worked a lot with the program called Tennessee School for the Deaf. And so I had students that had some intellectual disabilities and who also were deaf doing vocational training programs with us at the gardens. I had a paid student there. He was actually an intern in high school working for us. And then once the pandemic hit, we weren't able to do that. So this past fall, we began working with them again, actually doing virtual sessions using Zoom, and which was quite interesting, working with, we had 6 students that we worked with from Tennessee School for the Deaf, teaching them about gardening, but also communicating through sign language using Zoom. And so that has been a little tricky off and on because of sickness and quarantining, and some students having to go and come back. So it's been challenging to kind of keep running that. And we also work with a behavioral health facility that would come out to our garden once a month. So all that has changed, and we're just now, we actually started going back to another facility, assisted living facility, this month, as they've been able to vaccinate some of their residents. And so we hope to go back to more of the travel program and being in the facilities in the coming months as more and more individuals get vaccinated. So when we're looking back at the study, we're looking at one of the themes. The next one was AHTA operations and structure. And this theme really looked a lot at our professional organization, and through discussions of our interview participants, we did recognize, and they did recognize, the importance of a professional organization for the future of the profession in America. It helps advocate for program growth. It helps set standards. And so people do recognize and value that. However, as part of that, there were some frustrations that came up in the study. Some of those ranged from frustration with the what individuals in the study considered a lack of membership growth. Our membership is roughly a high point of about 1,000 members, and then early 2000s dropped down to around 800. And then we've been about 500 members since then, and we were actually over 500 last year, and that membership has reduced somewhat to the pandemic and job loss and not be able to continue that. Some other frustrations that were mentioned were, we talked about credentialing versus our professional registration, and some of the study participants did express frustrations that we seem like we've not gone anywhere, not made progress on that. And so they've been working towards developing a credentialing exam for quite some time, and hasn't seemed to make as much progress. However, this year we will be conducting our 3rd job task analysis, which will help set the stage for the credentialing program in the future. And then some other frustrations were just some difficulty in finding coursework and finding internship supervisors, basically difficulty in the process of becoming registered horticultural therapists, that people were frustrated about. And again, I mentioned membership numbers kind of have been holding steady for the last few years, but people recognize that there's a need to grow our membership in order to continue to grow the profession in the United States. So the next theme that we discussed, or that we found in our results of the study, included education and credentialing. And so by far, people didn't notice that there's a need for more education opportunities. There's definitely a lot of interest in using horticulture as therapy in the United States. And I really think that has grown, particularly in the last year because of the pandemic. But right now we have about 7 schools or 7 organizations that are certificate programs. So they provide the horticultural therapy education. In the years past, there was more, and those numbers have fluctuated. One of the issues has a lot to do with, people are in different locations and can't necessarily travel to a program. And so then, particularly with the pandemic, more of the certificate programs have been offering some online options, which have helped increase the availability and access to those programs. And so credentialing, I mentioned we did have a professional registration process, and the next kind of level of that is credentialing in the United States. So it requires the creation of a separate organization to manage the credentialing system, to develop a exam for the profession, that is conducted in a way that helps reduce any conflict of interest with, say, a professional organization like AHTA and a credentialing organization. It helps increase the professionalism through an additional level of education and determining whether individuals do meet the minimum qualifications. So, and then the third kind of level when we're looking at that in the United States particularly is we have what's called licensure. So, and that licensure system is something that is done by states. So to be a medical doctor, you have to have a license, and you have to be licensed in the state that you're practicing in. Other professions also do that. Social workers, there's a licensing for that. There's a licensing for nurses. Some recreational therapy, there is some recreational therapy licensure in certain states in the United States. And so once you get to your credentialing system set up and you have people, then you go state by state in the United States and apply to the state legislature to develop a licensing board, which is kind of like another layer of professionalism in managing healthcare professions. And the whole point of the credentialing and licensure and registration is to ensure that practitioners are trained and provide services that do not harm the patients and the clients that we're serving. So it's a way to ensure patient safety. One of the discussions that did come up during the interviews was this the concern of the future of educators. And so, like I mentioned, we have about 7 programs. There's about 8 universities, colleges that offer some coursework. Some are connected to certificate programs. But you know, the people that we studied, you know, did acknowledge that, you know, several of these educators are nearing retirement stage, and what happens when they retire, who's qualified to teach horticultural therapy coursework in the United States. And you know, an example is we did have one certificate program that the individual is retired and is not teaching anymore, and you know, that program had to end at this time because they potentially weren't able to find somebody to teach. So people are aware of that, and we're looking at trying to find ways to ensure that we do have the next generation of educators coming up so the programs can continue. And then along with the education element is the internship, which is sort of the practical real world experience once you complete your coursework, and be able to conduct an internship is supervised by a registered horticultural therapist. And again, we have 233 around the United States. And so it is limited where it's hard to find internship supervisors. It is a pretty intensive task as a supervisor to ensure that those you're working with have the experience and knowledge needed to gain from the internship and experience. So that is one of the challenges. AHTA has developed some online supervision and some distance supervision options to help improve that. But certainly as the profession grows and we have more registered horticultural therapists, there will be more internship opportunities in the future. So the next theme that we found was this public awareness and networking. And so a lot of the study participants did mention that a lot of people don't know about horticultural therapy. And when they talk to people about it, they often would respond like, well, that's a great idea. And I don't think I've ever really talked to anybody about using horticulture as therapy and had them say that wasn't a good idea. And it's an intriguing thing. People kind of understand the benefits of plants, particularly how they help improve our wellness and mood. And I think as people become more aware of the environmental issues, I think that understanding is growing, particularly in the United States. So that's one of the things we have going for us is this interest in gardening, interest in taking care of plants and growing plants and learning about plants that I think we can use as a profession to continue to promote what we do and expand our practice. The other several components that came up during this discussion was the idea of our regional groups. And so we do have some regional networking groups. Some are nonprofits around the country. Some are kind of just a loose organization. And so they kind of vary, but what they do is they provide local opportunities or regional opportunities for networking with other professionals, and also for creating more marketing and public awareness about the profession. And one of the study participants that I interviewed particularly said, the regional groups are kind of the workhorses of the profession. And some of that is because a national organization has a certain set of goals and priorities that they need to focus on nationally and to help the profession move forward. And regional groups can do a little bit different, and they can work in different ways because they're closer. So an example is, if someone's looking to do a article or a news article about horticulture and the therapeutic aspects of horticulture, going to a regional group, you might be able to find a local practitioner that you could go and video and interview that day, which, the news is often in a very short timeline to get information out. So it's a great way to get more information at a local level and faster for people. It's also a great way to promote the profession by creating smaller events or regional events that people can attend. Several of these groups have their own conferences throughout the year. And so, traveling to a large national conference that AHTA offers every year can be expensive with flights and hotel room. But if there's something close to me that I can drive, within a day's drive, I can do that much cheaper. And so it provides another learning and networking opportunity. And then the third part that was mentioned a lot about public awareness networking was the idea of working with the allied professionals. I originally became trained as a recreational therapist. And so, which is using leisure and recreation as a therapeutic modality. One of the things in the United States is gardening is still a very, very top leisure pursuit. I think some of our census data that we've collected over the years, would list gardening at the 60% of the people in the United States have at times reported that they gardened on a regular basis. So it's definitely a activity that people are aware of. It's a very important economic element in our country as far as purchasing garden supplies and materials and gardening and plants. So working with allied professionals that use gardening as part of their interventions is also a great way to expand membership, but also expand the profession and eventually train other people that might want to come and become also horticultural therapists. So, and the final theme that came up during our study was about research and developing research opportunities. So I think that's one area that we are needing more work in. Particularly, we need more randomized controlled studies with a control group, larger studies. A lot of the studies about horticultural therapy are smaller, have a smaller number of study participants. So it's harder to get that information that you could potentially generalize to the entire population. And some of that has to do with the way the programs are offered, whether, if you're doing a group program and you're doing a group study, you don't want to have 100 people in one session. It's not effective. And so finding a way to develop larger studies is going to be important. Finding ways to collaborate with other therapists, other universities, develop studies that are larger and bring in larger sample size can help provide more data for us to show the overall therapeutic effects of gardening, and particularly in a therapeutic setting. And some other things that in my study that we looked at, we understand well is, there's research about gardening and therapeutic aspects of gardening. These are two examples that were published recently. One was a gardening on a psychiatric inpatient unit, and that one in 2009. I looked at the researchers, and there wasn't a single horticultural therapist on the research team. And so that's one of the challenges we have also is people are conducting research, and we don't have horticultural therapists that are trained being part of that research. And so that's one of the things I'm continuing to promote and advocate is, we need to get more involved with research and collaborate more with researchers and other therapists in order to be part of the research and to contribute to the research knowledge and grow the amount of opportunities we have for research as a profession as we move forward. So, I want to take now to look at, what should the profession look like in the future? Growing the profession both here in Scotland and beyond. And one of the things I like to think when I'm trying to envision where we should go is to ask the question, if we woke up tomorrow and the profession was where it was, what would it look like? What do we want it to see? What do we want it to look like? What do we want to be doing as professionals? And I think there's some things through the study I looked at that we can kind of discuss and see, areas of where we can grow and areas, opportunities that we have to move forward and move the profession forward. So I think one of the things that we understand, one of the concepts that came up during this study was, the connection to nature. And so, we talk about the human people-plant interaction. We also talk in the profession a lot about the connection of nature and those benefits to people. And so I think one of the differences between, like nature therapy, ecotherapy, and horticultural therapy is obviously the people-plant interaction, the growing the plant, caring for the plant, tending for the plant. And one ways I like to look at it is, we are bringing nature anywhere. So going out, forest therapy, going out to the forest and sitting in and doing therapy among trees and plants and in nature is one thing, but not everybody has that ability to get there and access that. People who live in the United States, we have two big differences. We have people that live in urban settings, which may not have access to parks and nature and national parks. And we got people that live in rural or the countryside. And so they have more access. And so one of the things about horticultural therapy is, using horticulture can be done in an apartment, inside, in containers, or it can be done in a garden outside. And so there's a lot of opportunities to take our work and use the people-plant interaction and nature to combine. And I think as climate change is happening, I think the public is becoming more aware of nature. People are interested in gardening. One of the seed associations, trade associations, United States last year said the interest in seeds, the demand for seed grew 300% last year because of the pandemic. And so, I like to think of, we talk about victory gardens in the United States that really sprung up after or during World War II as a way to provide food when things were being rationed. And I think even last year, as supplies for food were dwindling in stores, one of the first things they went to was the idea that I can go plant a garden and I can have my own food in my backyard and I can control some of that. So it gives us some control. So I do think that the increasing awareness about environmental issues also does increase opportunities for us as a profession to promote what we do among the community. This one is really important, this idea of screen time. Particularly last year in the United States, we had a lot of schools were virtual, so using Zoom and Google Classroom and other electronic methods to communicate and work and teach. I remember as a child growing up, we used to get those big, thick textbooks, and now kids get issued computers, and so everything's online. But during the pandemic, particularly, there's been a lot more interest in outdoor classrooms, getting people outside because there's less chance of spreading the disease outside, and so that's where I think, again, as horticulture therapists, we have some opportunities to use a garden setting as a way to improve education, but also do it in a safe manner and hopefully reduce spread of COVID among people. So again, we've talked about opportunities in the educational system. Some questions, can therapeutic horticulture in schools improve outcomes? And there is some research on gardening programs in school settings and how they reduce stress, they improve attention, reduce attention deficit hyperactivity disorder, increase mindfulness. And so those are some areas that I think as we as therapists have the ability to potentially offer services and expand what we do. One of the challenges I feel that in the United States, particularly in school settings, are the continuity. And so when around 2003, I was working for an organization that was running garden and environmental education programs in schools. And so one of the schools I worked at was a middle school, and I actually took the time and we got some funds and we built a garden. We planted a garden out behind the school to help improve garden education. And it wasn't in a therapeutic setting, but it was very therapeutic, particularly for a lot of the students that the teachers sent me. They let me work with students that they didn't want in the classroom because they were causing problems and had behavioral issues and didn't listen, didn't respect, so they said, you can take those students outside and plant the garden. And it really, they worked, I had no problems with them. One of the most important things I felt that I observed with them was while we were building the garden, there were other students walking around in track, walking around the track near there as part of their recess or their gym class. And the students that were building the garden, who were considered some of the more disruptive students in the school, were like yelling over at their friends and saying, "Hey, look, I'm building this garden. You see what I'm doing?" So the sense of pride they got from that was very important. Well, I moved on and started working in another organization. And then in 2012, I began working for the University of Tennessee Gardens again. Several of the organizations and schools in the community started getting together and doing community meetings. And one of the things they said, it'd be great if we had a bunch of school gardens. And the issue with that is we had a school garden. We had, particularly in that school, they were talking about, we need to build a garden at the school. And I said, I already did that, 10 years ago. But what happens in a school is, in particularly urban schools, teachers move on, they get other jobs, the principals move on. Maybe they have funding to pay for some gardens, but they don't have funding to staff them. And then schools have new priorities of learning and educational requirements that puts challenges on them. So, the question I ask is, as we as therapists, what can we do? Is there a way we can find a way to fund programs in schools that we can become the continuity, that we can become the ones that are there and stay there year after year, even no matter what changes with administration or educational priorities, that we're providing programming in schools as a way to improve overall well-being and health for students in school settings. I think another element that we have to think about is this continued interest in what I call the well-being movement. The interest in not just health and absence of disease, but how we can prevent disease, how we can prevent other issues by maintaining and taking care of problems before they become major issues. So, increasing physical activity, increasing our health by gardening and being outside and eating fresh fruits and vegetables versus, sedentary lifestyles where we're stuck inside and we aren't physically active and we develop heart disease or diabetes, obesity, and other problems. So again, the nutritional aspects of gardening as a way as therapists, we can connect to the community and provide prevention services and thus help improve overall health of our communities. And mental health, also, one of the things we're looking at now is this pandemic-related stress and what has happened both as for healthcare professionals, but also just individuals and having to manage all the challenges we've had this year. How can a horticultural therapy program help improve reduce those pandemic-related stress issues and help improve wellness in general and help improve mental health during the time of pandemic and even immediately after that. So I think what's next is to really think about, we need to expand our communities of practice. And when I'm talking about that, I'm thinking about, virtual networking, like events like this, where we can meet people from other parts of the world and learn what they're doing and take some of what they're learning and doing and incorporating that in our practice, connecting to other healthcare professionals are other ways we can continue to expand what we need to do and help improve the overall profession. And I think one of the big things in the United States particularly is jobs. And so people did mention, there's a lack of jobs. And so finding ways to increase job opportunities. And so one of the concepts that came during this was the idea that there's a lot of horticultural therapists or some horticultural therapists in the United States tend to be more successful if they are able to create their own job or create their own business or nonprofit and really develop a program. And so, those are things which are good. It's a great, particularly for a new profession, but also we need to understand ways to how to develop sustainable job growth for people, or else there's no need for education programs to be offered out there. So I think what we need to focus on is how we can reconnect people to plants. And then we need to train, educate, and empower both professionals and practitioners, but also individuals. And that will eventually help us develop further increased job opportunities in the future as being strategic about how and what we do and who we work with. So I think, some of the next steps we need to look at are, one is, research, increasing research and the evidence-based practice of using gardening as therapy, networking again, nationally, internationally. So, finding opportunities to learn from other practitioners. and then ask lots of questions. How can our programs improve wellness? How can they improve health of those that we serve? What are other populations that we can develop programs for that that could use gardening and horticulture in a way to improve their outcomes and well-being. So I do want to leave you, one of the things that, again, this past year has been a challenge for everybody around the world. But, this one quote I like, it's when you're in a dark place, sometimes you think you've been buried, perhaps you've been planted, bloom. And I think it's important to know that, the profession of using horticulture as therapy is an important profession, particularly in today's world. And I think it's going to always have a value. I think we just now as therapists need to find ways to take these opportunities that we've been put before us and expand the profession that way and continue to promote what we do to the community and provide solutions to problems that we have in our communities. So that's all I had for the presentation. Now I think it's time for questions, if anybody has any questions.
Hello there. Yes, Derrick, there's quite a few here. That was really interesting. Thank you very much. I was scribbling like mad and my ears were buzzing like mad trying to pick up everything you were saying at the same time. But anyway, we've got a few here. Let's crack on with them. Your study in late 2019 looked at the AHTA membership. If you were to perform the same study with the regional groups, would you imagine that the results would
yeah, so that's a good question. I think that I don't know, and that's there are some bleed over of members in both groups, so there could be some similar things. But I do think one of the things I'm doing now is looking at what the next steps of research I would like to do, and one of those is to do some studies and look at regional group members and see what's different. And so I may not do another qualitative study, but I may do another survey type study using some of this information going forward, because I think we need to further understand what not just members of AHTA, but other people out there in the profession are also experiencing. So yes, I would like to do more of that study.
Okay, great, thank you. Few people interested in the raised beds on wheels. There was an image you put up of raised beds and wheels.
Okay.
Where did you source that, or was that an in-house product?
That one, let me go back to that, see if I can find that real quick to make sure. I think I know which one they're talking about. Yeah, right here. So this, yeah, I have to share my screen again. Yeah, so that is a raised bed system that was built by a company close to us, a local company. And they donated that for us. And he actually had a brother that I think used a wheelchair, and so he developed and designed this. And this is I think we have 3 or 4 of those in our gardens. It's very nice because those wheels lock, and you can unlock them and move it around. So again, it's built by a company in Cleveland, Tennessee, and it's kind of heavy. So I'm not sure if they would. I don't know if it's something you could ship. And I'd have to look up the company's name, but it was a local company that donated those to us as a demonstration for some raised beds.
Well, I think there'd be quite a few of us very interested in having that fella close by to us.
Yeah.
Okay.
I'll email folks in Trellis to the link to that page once, so you can kind of look at it and see.
Yeah, perfect. Thank you for that. Okay, John, our board chair, would be interested in just getting a little bit more detail. You did mention the education and credentialing opportunities, but can you just maybe go back a little bit and give us a wee bit more detail on the pathway or the criteria for being a certified practitioner in AHTA? And, like the certificate course that is offered, how many hours of study did that involve?
Sure. So yeah, for AHTA offers right now, it's a voluntary professional registration system. And to do that, there's several qualifications. One is you have to have at least a bachelor's degree from a university. And included in that, while you're getting that bachelor's degree, you need to take a certain number of coursework. So let's say if you get a bachelor's, let's say if I have a bachelor's degree in counseling or recreational therapy, like I have a master's degree, you need to take 3 horticultural therapy courses, or a total of 9 hours of college credit. So I'm not sure how the hours relate to, I don't know, in Scotland, but we have a semester system in the United States where a 3-hour course, you would meet 3 hours a week in person for 16 weeks. That's what they call a 3-hour course. So you would need 9 hours for horticultural therapy coursework, which includes introduction to horticultural therapy, something related to horticultural therapy program management, and then one related to something like horticultural therapy techniques. AHTA's website lists all that in more detail, so I'll just kind of overview it. And then you also have to have 12 hours of plant science coursework. So that's about 4 classes, things like introduction to horticulture, plant propagation, pest and disease management, and usually another elective like plant materials, plant identification, greenhouse management. So that'd be 4 of those courses. And then 12 hours of what we call human science coursework. So that would be introduction to psychology, abnormal psychology, human development through the lifespan, and counseling or some other elective like working with different specific populations. So once you complete, you have a bachelor's degree and you have all those coursework minimums, you have to do an internship, which is 480 hours supervised by someone that is a registered horticultural therapist. And again, they have distance options for those now and online options. And then you submit your application to AHTA, and they have a review board that reviews that qualification. So they make sure that people are taking the right coursework and did complete their internship, and then they'll grant the HTR status, which is registered horticultural therapist.
And breathe. Once you've done all that, that's amazing. Great. Okay. I think that's cleared up for me, definitely. So hopefully, John, that's answered your question. Claire and Sally have both commented on the length of time that the likes for music and art therapies have taken to become registered professions, both in the US and here. And they're just commenting that they're really hoping that it doesn't take so long for social therapeutic and horticulture to have that registration also. Joe is wondering, how supportive are central government of horticultural therapy? Do they see it as a valuable contribution it can make to society? And do they provide any funding to support it?
So that is interesting. In the past, back in the 90s, AHTA actually received several grants from the government to support programming related to horticultural therapy. And the grant that ran out. And so right now, I think the government doesn't have as much knowledge, and I think that's where public awareness we have missing about that. It is, one of the ways in the United States to do that is it really takes a lot of time and a lot of money to lobby the government to help get funding, to help with regulations and things. And so our organization doesn't really, that type of lobbying and government advocacy hasn't been as much part of our organization as, say, other professions. And that's one of the limiting things. An example, as a recreational therapist, the American Therapeutic Recreation Association has a lot of governmental lobbying, and basically where we have representatives go up to our elected officials, meet with them, discuss the profession, discuss the needs, discuss hey, let's start a bill to do this. And in the United States, one of those challenges, or one of the areas in healthcare, is we have a national healthcare program that's called Medicare, which is the government funds for people with disabilities or people that are over a certain age. And so one of the first ways to get payment for services through that healthcare system is to get laws passed saying that this particular intervention can be, should get paid for from Medicare. And so in recreational therapy, particularly, over the years that they have had wording in the different bills related to Medicare in there talking about recreational therapy. And then at times the government has written that out. And so then they lost the funding that way. And so horticultural therapy really hasn't done that as much. And so that's, I think, one of the issues that we have with particularly funding and job opportunities is there's not as much funding for that. So that's an area that, you know, we probably do need to look into. It just becomes very expensive to do that kind of lobbying. And the we would have to kind of have a different organization to do that based on some of the regulations of how AHTA is set up.
Okay. Joe, I hope you got all that written down, Joe.
And he can email me if he needs to.
No, that's great. Thank you, very thorough. Angela is asking Derrick, given the cost of studying in the US for overseas students, are you aware of any scholarships?
So not particularly, you know, and one of the things, there are some online programs, and I don't know how they work with internationally. Some of them at a university have now the point where it becomes in-state tuition because it's online. But so, like, for instance, if I go to the University of Tennessee and I'm from out of the state of Tennessee, I have to pay a lot more to take college courses versus a resident because the state funds some of that. So some of the online programs don't have a difference in fee for taking an online program versus being in state. So that makes it a little cost effective. But and then I don't know of any specific funding to help cover those costs at this time.
Great. Okay, thank you. Jenny asks, you mentioned 60% or thereabouts of the population are connected to gardening in some shape or form. Is there obvious generational differences that might indicate a skills gardening gap?
I think so. I think, you know, when I work in the assisted living senior facilities, those individuals still remember a lot growing up. Some may have been, you know, during the World War II time and things. And so they remember gardening, they remember their grandparents gardening, they remember, you know, the importance of that. And that is one of the neat things to work with that population, is because, you know, they can often share some stories that they have growing up of gardening. You know, I think as we've modernized more, I think there's less people gardening, but I do know the younger generations, you know, like those in their 20s right now, this gardening, in container gardening in apartment spaces is becoming more popular. And so I think there is some increasing interest in those fields. And then I think, you know, I think the younger generations, just in general, the less access to nature that they're having and outside, and you know, spending more time on playing video games, it is potentially causing some problems with overall garden knowledge. And I think, but I think there's some changes happening, you know, related to the pandemic. I think particularly that people are interested. I know people just all of a sudden were like, let's go plant some things last year, and even those people, you know, don't have as much knowledge of how to grow as well. And so, you know, there was a lot of public gardens in general did a lot of free programs to try to help give people those skills. But yeah, I think there is a deficit in overall garden knowledge that probably does need to be addressed.
Yeah, sounds very similar to our situation here in the UK. Okay, question on outcome measurements. What outcome measurement tools are utilised or have been useful, in your opinion, in the US for horticultural therapy programs to provide evidence-based practice?
Okay. You know, that's, I think when we're talking about research in general, that is one of our biggest challenges is there are not a lot of validated assessment tools for horticultural therapy. And then you find that a lot of organizations will kind of do their own documentation assessment that in-house, and so they develop it based on their specific needs, and it doesn't necessarily get published or translated into other populations. So that is one of the areas in research I think we need to build up is, you know, what kind of tools and assessments we use. If you get an occupational therapy assessment, they've got these assessments that are validated, and they just, pull them out and run through them. Versus in a lot of horticultural therapy, I think people are having to create their own. There's been a few publications on studies over the years, and sometimes you'll find a good study that talks about an instrument, but they don't really share the instrument, and they don't license it, and they don't make it available to use. And so then you can't take that instrument and use it and continue to validate it. So that becomes a challenge, I think, within the profession also.
Okay, yeah. And lastly, we have a question. Do you, Derrick, see a difference between horticultural therapy and therapeutic horticulture?
All right, that's a very good question. So, and so the AHTA has a definition for both of those terms, and so there is a considered difference. Horticultural therapy is the use of horticulture in a clinical setting with clinically defined goals and objectives, often by and those things are developed or are prescribed by a doctor or a medical professional, nurse or doctor. Versus therapeutic horticulture is the use of horticulture in therapeutic settings by someone that is trained in the use of horticulture and therapy. So, for instance, I could be a occupational therapist, and I might be gardening, and I might have gotten a certificate in horticultural therapy. So I would be potentially doing therapeutic horticulture in that essence. So based on that definition, I do have to say, I'm also, as I mentioned, a recreational therapist, and they have the same issue with terminology. We have recreational therapy versus therapeutic recreation, and those two terms are also seemingly same, but also there are different people in that profession that are very opinionated about how they're different. And I think that has been one challenge as our profession is what is what, and moving forward, we need to understand how to work together to ensure, if there is a difference, what the difference is, and how do we determine that. If we're talking to the general public, they're not going to really understand that difference as much as I'm using horticulture and it helps improve my health.
Okay. My mantra in life is keep things simple. So maybe we're needing to simplify down some of the confusing stuff that comes into it. Great, Derrick. Thank you so much for taking all that time to answer that that selection of really good questions. Unless somebody posts one up really, really quickly, that's you. You can breathe now, and I'll hand you back over to Jenny. Thank you.
Thank you very much, Derrick. And I'm just going to put us on gallery view so we can all see each other. Thank you so much, and very stimulating. I think there's going to be many more conversations to be had there in therapeutic gardening networks across the globe with that. So thank you very much. And I'd just like to ask you to show your appreciation. If you hover over your reactions button at the bottom, we can give a round of applause and some recognition to Derrick there. Thank you very much, Derrick. That's terrific. And thank you to all of you who have already donated to Trellis, but if you've enjoyed today's session, please consider making a donation to support future work like this. Or you may be interested in our plastic-free gardening book, which is on offer this week, so don't miss that. And there's a link to that in the chat just now. I'd like to bring this session to a close and say thank you very much for sharing it with us. We will look forward to seeing you perhaps tomorrow. There are 2 more sessions. Please have a look on the website and sign up for them. I will leave you with a link to our feedback survey in the chat. And we're very interested to know what you think of these sessions and how they affect your therapeutic gardening practice. So we'd really appreciate it if you can take a few minutes to complete one. So I'd like to say now goodbye from all the Trellis team, and thank you. Goodbye.
Thanks, Derrick.
Thank you.